Vitamin D deficiency can contribute to lingering joint discomfort and stiffness in various joints throughout the body. In simple terms, vitamin D helps your bones and joints absorb calcium, which can reduce the risk of bone and joint pain. Common symptoms of low vitamin D include bone or joint pain, muscle weakness, and fatigue that doesn't seem to improve. Even without a diagnosis, many people can benefit from checking vitamin D levels if they have persistent joint discomfort. There are natural ways to boost vitamin D: short sun exposure, fortified foods, and vitamin D-rich sources like fatty fish. Aim for moderate sun exposure on bare skin for about 10 to 30 minutes several times a week, depending on your skin type and location. Dietary sources like fatty fish, fortified dairy, and mushrooms can help maintain adequate vitamin D levels. If sunlight and diet aren't enough, supplements can be used under medical guidance to safely restore vitamin D to healthy levels. Improving vitamin D status can help reduce joint pain and improve daily function. But persistent symptoms should be discussed with a healthcare professional. Key takeaways: assess vitamin D status if you have unexplained joint pain, balance sun exposure, diet, and supplements, and seek professional advice for personalized care.